Hey, Tomas here. Welcome to the next video in the Clinic Success Academy. By the time you finish this video, you'll know the 3-step value stack framework for presenting any treatment, and the one step that most providers skip without ever realizing that it's costing them bookings. Let's get into it. So here's the whole foundational truth this entire video rests on. Patients don't invest in treatments, they invest in outcomes. Say it again, write it out. Patients don't invest in treatments, they invest in outcomes. Here's why that matters. Most clinics walk through their services explained in clinical detail. Oh, we have the best Morpheus 8 treatment out there. Oh, we've got the latest MCELA device. We've got the best, latest and greatest laser machine. Again, if you think about it, the metaphor I always give is, we want to sell the vacation, not the plane ticket. If you're in Europe, you're familiar with the airline Ryanair. Shocking airline. They sell flights for like €40. But when you buy a Ryanair ticket, you're not thinking, I can't wait to get on the plane. I can't wait to sit in this uncomfortable chair. You're thinking, I can't wait to be eating pizza in Italy or drinking wine in France. This is ultimately, again, because people think in images, not sentences. So we don't want to be focusing on the treatment or the device or the mechanism. The treatment will then nod and say, okay, I still need to think about it. And the provider will be confused. Again, if you're medical, if you're a doctor, if you're a nurse, if you're a dentist, chiropractor, you're going to be confused because you probably spent years training in the medical space. But you have to remember, most people don't nerd out about the specifics of the modality because they're going to think, what's there to think about? Here's what happened. The patient couldn't picture themselves in the plan. You gave the information, but what they needed was a picture, a specific, vivid, personal picture of their own life on the other side of the treatment. Think of it like a recipe. You handed them the ingredients and the method, but you never said what was for dinner. It's like the difference between trying to sell someone flour, eggs, milk, and other ingredients or in baked goods versus selling them a cake. The patient couldn't see that the meal was on the table, so they walked out hungry. So without the picture, there's nothing for them to say yes to. So the value stack is really simple. It's 3 steps in order every single time. The order matters. Step 1, what it is. Start with the clinical label, then immediately the very next sentence give the plain English definition. Finish with something that a 10-year-old could repeat. The rule is to define immediately or lose them. Every word they have to mentally work out pulls their focus away from everything else you say next. Step 2, how it works. Plain language, no jargon, mechanism explained like you're talking to a friend over a coffee. Short sentences, concrete sentences. We use a very fine needle, takes about 10 minutes. We start conservative. We'd rather a little less and top up at your 2-week check-in than overdo it the first time. Simple. If they have to Google a word, you've lost them. Step 3, what it means to them. This is where it all comes. This is the important part. This is what almost every clinic on the planet leaks. Steps 1 and 2 feel complete and you're probably doing them already. They feel like you've done your job. Step 3, that's where the patients actually see themselves in the outcome. Without it, you've delivered information without conviction. You've sold them the plane ticket, but not the vacation. Tie the treatment back to the specific outcome that the patient told you in the discovery phase. You can see how this entire thing ties together. So use their names, their dates, their places. You mentioned your sister's wedding in July. Softening starts in 7 to 10 days, full results in about 2 weeks. We'd schedule in about 3 weeks before the date and you'd have a touch-up review at 2 weeks, dial it in. Now they can see it. You can see how this beautifully ties together. Again, like a recipe. And that's something to say yes to. So again, steps 1 and 2 are about your treatment. Step 3 is about their life, that you care about them. They're not a name, they're not just a booking. They're someone you care about. And that's the distinction. It's about their life. When you stop at steps 2, you've described a procedure, probably like everyone else they've spoken to. But when you complete step 3, you've painted a future. Patients will tolerate procedures, but they'll invest in their futures. Most providers will skip step 3, not because they don't care, they do, but because steps 1 and 2 feel gone 80% of the way, but it's the last 20% that will actually get it over the line. But what they haven't noticed is a patient is still sitting there with a vague picture, not a specific one. So the fix, before you move on from any treatment description, is to always name the patient's specific outcome back to them. Not you'll look refreshed, not you'll feel more confident, their outcome specifically, their timeline, their event. If you don't know their outcome yet, that's the gap to close first. And that's why the discovery section is so important. Go back to that video if you have to. But if you know it and you don't use it here, you have left the most powerful conversion lever on the table. And that's why this framework is universal. The names of the treatments will change, the framework doesn't though. It's aesthetics, Botox, purified protein that relaxes the muscles, causes lines, conservative dosing, ready for your sister's wedding in July. Regenerative medicine, PRP injection. We draw a small sample of your own blood, concentrate your repair cells, and re-inject directly into the joint. By autumn, you'll be walking your dog without stopping every 10 minutes. Dentistry, whitening treatment, totally enamel safe, formula applied in chair, about an hour. Your daughter's wedding is in October. You'll be comfortable smiling in every photo. Chiro and pain management. Decompression series, we reduce the pressure on the disc using controlled traction, 6 sessions over 3 weeks or so. You'll be back on the tennis court by spring. That's a realistic target. See what I did there? Same 3 steps, different vocabulary, different vertical, exact same result. Now, what I've just talked about is powerful. It's worth pausing on this. You can see why we stress the importance of going through this program for all of our clients. Again, if you're watching this video and you're a client or you're not, I highly recommend, first of all, if you're not working with us, reach out and get in touch. If you are with a client of ours, see how this entire thing fits into an overall system. Have you skipped over any parts of this course so far? Because you can see how it all builds on top of each other. Everything I'm talking about here in this course is free. It doesn't cost a single extra pound or dollar on your ad spend. It doesn't require a new hire. It doesn't require a new service or a new patient. It's the cleanest example of why most clinics, again, don't have a marketing problem. They have a sales problem and a systems problem. Every clinic we work with has 30 to 50% more revenue available inside the same lead volume they're already paying for. Again, the Predictable Patient Engine is designed to capture that revenue. And the value stack that I've just talked about is one of the levers we pull to do it. It's a treatment presentation that covers all 3 steps. They'll convert a much higher volume than the same treatment described clinically every single time. Again, the marketing didn't change, the ad budget didn't change, the patient changed because they could actually see themselves finally in the plan. Easy but powerful concept. Here's what we covered today. Number 1, patients invest in outcomes, not treatments. That's a whole foundational truth that the whole framework rests on. 2, 3 steps in order every time. What it is, how it works, and what it means to them specifically. 3, step 3 is where most clinics leak. Name the patient-specific outcome back to them with their timeline and their life event before you move on. That's the difference between information and conviction. So I'm going to want you to pick one treatment you present most often, write out all 3 steps for it right now. Step 1, clinical label plus plain English definition. 2, mechanism in plain language, short sentences, don't make it a big deal. Step 3, a specific patient outcome from a real consultation this week. Their name, their date, their event, read it out loud. If step 3 sounds like a brochure instead of something that's like someone's actual real life, rewrite it until it doesn't. So run this as a 10-minute team drill. Pick 3 treatments. One person will present each using all 3 steps. The team listens for one thing. Did step 3 name a specific outcome or did it sound generic? You'll look great as generic. Ready for your sister's wedding in July, touch up at the 2-week mark is specific. Iterate until everyone can nail step 3 without prompting. As always, record it, drop it into your Slack channel. I look forward to giving feedback. I'll see you in the next video.